Good afternoon. I'm Lisa Broom with the CBC News Break. Minister of Health John Boyce strongly believes Barbados has what it takes to virtually eradicate the Aedes aegypti mosquito, which carries the Zika virus. He gave this assessment during a vector control seminar at Warren's office complex yesterday. It's a collaborative effort between the Environmental Health Department, the Barbados Tourism Product Authority, and the Barbados Hotel and Tourism Association to train hotel workers and others in the field. Mr. Boyce says the Health Ministry will have a sustained vector eradication plan even after the ongoing 3-month arboviral disease eradication program is complete. He says this approach is necessary to eliminate the threat posed by mosquitoes.
We now believe that we can eradicate the mosquito, and that is the plan. We want to be able to tell the world that we have eradicated the Aedes aegypti mosquito. That doesn't mean that we won't see one single mosquito in Barbados. That's not what eradicate means in this sense. What we mean is that the threat will be so reduced that no one would expect to be contract any of the diseases that are borne by this Aedes aegypti mosquito. So we're going to pay much stronger attention, and with your partnership, we're going to make sure that we implement a very effective, continuous and sustained program in Barbados to make sure that we get control of this threat entirely.
Dr. Kerry Hall, CEO of the Barbados Tourism Product Authority, says the tourism sector will be resilient even with the looming threat of the Zika virus. She, however, remains concerned about its potential to derail the good gains made in the industry.
For the last couple of months, the industry has gone through some challenges. We're even wondering, what is this, like the 7 plagues of the Bible, where every day is something else. It was chikungunya first, and we overcame that. Then after that, it was the sargassum seaweed. Then we overcame that. And just when we were having the highest numbers since the recession started in 2008, where there are a lot of tourists on the island, and we finally breathed a sigh of relief for the industry, up comes Mr. Zika.
The issue of overcrowding at the Accident and Emergency Department of the Queen Elizabeth Hospital can be addressed if cases classified as not urgent are seen at other healthcare facilities. Dr. Shani Williams, who heads that department, says 20 to 25% of cases seen fit that category.
15% of those actually have no diagnostics at all. So they come, they see the doctor, and they're discharged. Those persons can be seen anywhere in the healthcare system. And armed with the information that 40% of persons have out-of-pocket expenses, if we do assess the capacity on island, and we do try to improve access to those persons on a 24-hour basis, we think that we can divert some of the overcrowding situations from the emergency department to other facilities that are available on the island.
Dr. Williams says elderly care contributes to the issue of overcrowding at the A&E.
Almost every day we have an elderly person who actually lives in our department, sometimes as long as 4 months before they can be placed in the community. Again, it really reflects on our society because for one reason or another, persons have found the misfortune to be left in the emergency department, which is an expensive place to house a person for nursing care services.
The Barbados Association of Medical Practitioners is against any co-fee for healthcare services. President Dr. Carlos Chase made his organization's position known during a town hall meeting on healthcare financing. He wants to see a new approach taken in the operations of the Queen Elizabeth Hospital, the island's polyclinics, and the Barbados Drug Service. Dr. Chase also proposed the establishment of a health, education, and security fund.
$100 is data source from everybody, paid into the security fund, managed by the NS. So this is separate and apart from government. Okay, it's not going to consolidate fund. If you estimate 100,000 people employed, $10 million per month, $120 million per year, and this is a fixed sum we can generate. So we don't have to if and but. We know we can get $120 million per year fixed based on that alone. Our ministry and NS is used only for health, so we're not going to depend to pay when we short on something else or other things.
Former CEO of the hospital, Winston Cullimore, says those who want to take the healthcare sector forward must be visionary and tackle problems before they emerge.
Before they get in an even worse state, which we are much harder to address. So what you're actually doing here is right. The consultation and so on, that's right. You will see that in the UK, the health service, that's a statutory thing that you have to do. You cannot make any major change in the health service unless you do a statutory consultation.
A 14-year-old girl from Six Men's St. Peter has been reported missing by police. She's Keena Iyad Austin, a student of Darrell Jordan Secondary School. Yesterday morning, she left home dressed in her school uniform, carrying a pink North Face haversack. She reportedly attended school but did not return home. Keena is about 5 feet 9 inches tall, has a muscular build, light brown complexion, and has brown short straightened hair, as well as an erect appearance. Keena also has eczema on both legs and ankles and is in the habit of biting her fingernails. Now, anyone with information relative to the whereabouts of Keena Austin is asked to contact emergency number 211 or the nearest police station. Time for a break now, but when we come back, regional and international news.